morning, everybody.
Good morning.
This is Abby.
Hello. Hi,
This is everybody.
Good to meet you all.
Yeah, and you may recall Abby has come to us before. She did like a little series about anxiety a few years back.
Oh, yes.
And then we had our own line toward the end of the pandemic talking about effects of the pandemic on families. And now with our implementation of our Welcoming and Inclusion Initiative, I think a lot of questions come up about what's the deal with pronouns. We know that some people don't pick the pronouns or wish to be called the pronouns that we might guess. And what's that all about? And there's a lot of somewhat confusing new just language around talking about gender and identity. And so since Abby works with some particularly adolescents and young adults who are going through some of these sorting processes and changing and working with some of the language, I feel like she has a great perspective, and she knows us. She's a friend of Covenant. So we welcome Abby back to talk about.
Thank you. I appreciate that. We're trying to get some things figured out here. Oh, there we go. So again, my name is Abby Surbello, and I'm a licensed clinical counselor at Center for Psychology over on Henderson Road. And I've been working there for about 15 years at this point. So before that, I had worked in other mental health settings and specifically in Northeast Ohio, but now I've been back in Columbus for some time. And as Tori mentioned, this is an area that is particularly important just because of the populations we serve as therapists and people also in the medical community. So one thing as a therapist I have realized is that everybody looks to be understood, right? And we want to feel that people respect us for who we are and have interest in getting to know who we are. And so I think gender diversity is just one other way that we can do that, right? Just as we do with identities related to race, culture, sexuality. So today we're going to talk about gender diversity. And it's surprising when you do research on what gender means, how many different explanations you're going to get, right? And so what I did is I kind of compiled some common definitions that you will see when you do searches like that or you ask somebody who works with gender affirming care. So a lot of times we see it as, right, characteristics of women, men, girls, and boys. We sometimes even use the terms feminine and masculine to describe that. And really that there's this cultural determination to it, right? That we have these norms and these roles and behaviors specific to males and females in our society. And one theory is that this is really socially constructed, which just simply means, right, that gender is interactional, that this is a part of the social construction theory, that there's really no inherent gender, that is really constructed by social expectations and gender performance. So some will even say that it's how we do gender, right? And that that's really been subject to change over time and in various cultures. So because of being in the counseling field, I did put on here the American Psychological definition of gender, which is attitudes, feelings, behaviors that a given culture associates with a certain biological sex. So there's somebody that's very prominent in this field, Judith Butler. They're an American philosopher and gender studies scholar, and they've been a really prominent voice in the area of gender and have developed the gender performativity theory, which I'll actually show a clip in a little bit here so she can explain a little better about what that is. But one of their very well-known works is called Gender Trouble, which they wrote in 1990. And Judith herself is a lesbian and non-binary, so she is very instrumental in this field. So let me pull her up here.
It's one thing to say that gender is performed, and that's a little different from saying gender is performative. When we say gender is performed, we usually mean that we've taken on a role, we're acting in some way, and that our acting or our role playing is crucial to the gender that we are and the gender that we present to the world. To say that gender is performative is a little different because for something to be performative means that it produces a series of effects. We act and walk and speak and talk in ways that consolidate an impression of being a man or being a woman. You know, I was walking down the street in Berkeley when I first arrived several years ago, and a young woman who was, I think, in high school leaned out of her window and she yelled, "Are you a lesbian?" And she was looking to harass me. Or maybe she was just freaked out, or she thought I looked like I probably was what I wanted to know. But instead I just turned around and I said, "Yes, I am." And that really shocked her. We act as if that being of a man or that being of a woman is actually an internal reality or something that's simply true about us, a fact about us. Actually, it's a phenomenon that's being produced all the time and reproduced all the time. So to say gender is performative is to say that nobody really is a gender from the start. I know it's controversial, but that's my claim.
Back to my slides here. So obviously this is one perspective. So there's controversy in how we even talk about what gender is. And that is just one part of then, right, gender identity and the way we express identity. So looking deeper into gender, just to offer another perspective, there is an article, if you want to look into that, called Time to Move Beyond Gender Socially Constructed, that is written by a psychologist. And he talks in this article about some of the contradictions that he thinks that this theory has. One you can see here, right, that if gender does come from culture, how is it that it can also be an inherent property of an individual person? So if you want to, like I said, get more perspective on that, I would suggest to read that article. There we go. And now let's talk about binary. I'm sure you have heard the terms binary versus non-binary. And my assumption is that most of us are more familiar with binary terms to describe things. Because historically, right, in Western culture, those are the terms that we use to describe the biological female and male sex, as well as the gender that goes with that. And I think a lot of times through history, we've really viewed those as one and the same. That what we're assigned at birth is also our gender. And we're starting to see that in different terms now. And we see that through the movements we've had, whether it be the feminine movement or historical events. Religion has, right, played a role in how we define and see gender. And I gave some examples here because obviously, right, women having the right to vote was something that was not always a privilege or a right for women. And that has changed throughout time as far as what we can do and the rights and the personal freedoms. We have biblical texts that even if we don't subscribe to them and take them for a literal meaning, like this one from Hebrews, likewise husbands, live with your wives in an understanding way, showing honor to the woman as the weaker vessel, since they are heirs with you of the grace of life. And then I found a article from Ladies' Home Journal, 1918, which I found interesting, that advised to the public that the generally accepted rule is pink for boys and blue for girls. And the reason that pink, being a more decided and stronger color, is more suitable for the boy, while blue is the more delicate and dainty, prettier for the girl. And look at how that has changed, right? Look at how that has changed. So I can't help to think that Judith's, right, perception of how culture affects this, that there's some truth in that. Because if there isn't truth in it, then why are we having these changes, right, over time? So now to understand non-binary. This is really the umbrella term for gender identities outside of those binary terms. So before, right, you go to the doctor's office, you check male or female. Now that has expanded to other things, right? And so this would be because of the non-binary understanding. And I'll be the first to say, I was talking about this with Tori beforehand, how people define what non-binary means is different to different people in different groups. So we can't really have general rules, but it's just the understanding that we are functioning outside of just the binary terms, right? So one way that somebody might describe themselves as being genderqueer. And for one person, they might describe that as that's because sometimes there's certain days or certain times in my development that I identify as a female and other times as a male. So that's one term. And then transgender, which a lot of times we just say trans, right, is when somebody's gender identity differs than that they were assigned at birth. So I'm sure a lot of you already know this, but non-binary people have existed throughout history. This is not a new phenomenon, right? So I was reading about the Hijras, I hope I'm pronouncing that right, in Hindu texts, where there was a third gender. And these were people who did not identify neither as a man or a woman. And in the Hindu religion, right, there was obviously positions that they were being held and they were viewed as sacred. So these people were people that had special roles within their culture and were viewed as having almost not special powers, but just special insights into things. So I think that that's something, really important to keep in mind. And it wasn't until like the whole British colonization that then these people started becoming criminalized. So as we had other cultures influencing the Hindu culture, right, then it started to be that these people who were possessing these roles, there's something wrong with them. So we can see again that interplay of how we affect one another. And then I also was reading about in the Byzantine Empire, how people were assigned female birth that would go on to be in male orders as monks, and that they would use their pronouns interchangeably. So again, just a good reminder that this is something that has been going on for some time, but that in American culture, we've been hearing a lot more about in recent years, right? So what is gender identity, right? What is it? It's a personal sense of your own gender. So developmentally, we know that gender identity begins as early as 2 years old, right? So very young age. And by the time you're 3 or 4, we can see that expressed, that people's understanding of their gender identity is expressed through how they behave, how they act, the norms of which they abide to. So this is obviously another way that we understand ourselves as people, just like I was sharing about with how we understand ourselves from a sexuality standpoint or a racial or spiritual standpoint. So cisgender, you might be familiar with that term, it's when our gender identity corresponds with what we were assigned at birth. And we hear people talk about, especially in the trans community, that this is kind of a privileged position in the sense that then we probably don't think about our gender much. And one thing I can tell you as a therapist, when I work with people who are non-binary, thinking about gender is something they think about every single day. They think about, how are people viewing me? How is it that I share with other people what my gender is, especially because they have me in a box that I am female, I am male, and I'm not that, right? And so I don't know about the rest of you, but I can tell you that I don't think about my gender every day, all through the day, right? And there's a reason for that because, right, as being someone who's cisgender, I'm not combating a lot of the things that the non-binary people are. So again, back to the transgender, right, the understanding that there are people out there that this is their experience, that they, right, their sex that they were assigned at birth does not match the identity that they have. So as far as some of the, biological pieces of it, I think it's important to talk about this because there are people who do have different types of conditions where they are going to have different chromosomal, groupings. And so typically, right, we know that people are XX for females, XY for men, and there's variations to this that we see in science, that people are born with XXY, XYY, XXX. And so I looked up because I wasn't sure on the stats on this, but it's 1.7% of births are people who are born with reproductive or sexual anatomy that doesn't fit male or female. And so a lot of times medically we talk about that being like atypical genitalia. And as you can imagine then, for people who are born, right, with these type of conditions, what they identify with is going to change or be affected by the conditions that they have. One particular one that I looked up is congenital adrenal hyperplasia, which is just a group of genetic disorders that affect your adrenal glands. And we know that adrenal glands are important as far as hormone production in the body. So having this condition can affect growth, an excess of androgen, which is a male sex hormone, and atypical genitalia. So these are some of the factors that can go into, right, gender identity and how people express their gender because they don't necessarily fit what we typically see with the male and female anatomy or reproductive parts. So As far as expression goes, how we express our gender identity, we can do that right through pronouns, through the clothes we wear, the hairstyles we have, the behaviors and the body features. And piggybacking on what I was talking about, I think it's important that even if somebody does not have a physical or medical health condition that affects this, we can still be in this non-binary category, right? And so a lot of times people do not have one of these conditions, but at the same time, still identify or know that they are a male or female, regardless of what they were assigned. So as we know, gender expression changes over time, just like identity does. It's something that isn't static. It's something that's more fluid. And I thought this was an important point that I was reading an article that this Dr. Angela Gofford brought up, is that it is developmentally appropriate for teens to explore all facets of identity and expression of identity. So basically what that's saying is we see this with teenagers all the time, in that they are trying to figure themselves out. And gender is no exception to this. Gender is yet another way, right, that they're able to identify and express themselves. And I think that's an important thing to kind of normalize. Gender fluidity. Right? This is the idea that over time and in different situations, someone's identity changes. And I meet people all the time that talk about that on certain days of the week, certain months of the year, right? That how they identify or how they express their gender changes. So it's something that is very fluid, which maybe for some of us in the room, that hasn't been our experience, that our gender has changed throughout time, but this is something that a lot of people do experience. So we know that, right, they're not really abiding by what our norms are and our expectations in those binary terms. So Philip Hamnick's talked about how there is a new confidence among newer generations to be more authentic, right, in these gender identities. Because I have met a lot of people who have said that growing up as a trans person in the 50s or the 60s or 70s was not something that was talked about, but it definitely was very real for them. So gender terms, you probably heard a lot of terms when it comes to gender, and because the list is pretty exhaustive, I have, a 7-page pamphlet over there about all of the gender terms. I thought I'd hit on just a few of them. Being androgynous, right, being both masculine and feminine. Being intergender, I've met people who describe themselves as being between male and female. Agender, I've had a couple clients that identify as agender and not having any gender at all is how they would describe it. And then we have the gender expansive, which is someone who has a more flexible gender identity that's common with gender binary. So meaning that they might have times where they say, no, I am male or I am female, and they identify with those binary terms, but that again, that changes over time. So gender dysphoria, this is actually a newer condition in the DSM-5, which is the manual us mental health professionals use to diagnose. Before it was called gender identity disorder, and because of the stigmas attached to making gender identity, realms or issues a disorder, this has since changed. So this is when there is a conflict between the sex you were assigned at birth and the gender you identify with. And I really want to point out that this really involves a measure of distress for the person. Not everybody who's non-binary feels distress associated with this. And I think this is something that especially the trans community is trying to make clear, because there's been kind of an assumption by the public that there is some level of distress or discomfort, and not everybody actually experiences that. So some of the signs that we see, as far as what is expressed, might be low self-esteem, becoming withdrawn or socially isolated, feelings of depression and anxiety, taking unnecessary risks. And then when we look more at the diagnostic parts, you can see here how the difference between your gender identity and genitals, right, that is one of the qualifications for this diagnosis. A strong desire to be rid of those genitals or secondary sex characteristics, a strong desire to have the genitals or characteristics of another gender. And so you can see they even use the word like a strong desire or a strong belief as a way to just try to conceptualize, again, somebody's maybe like a strong urge to change that, and again, having some measure of like discomfort with it. So here, again, I just reflect on how this has changed, because if you look at the DSMs over the years, how non-binary people and conditions associated with them has had major changes. I think it was in the DSM-3 that we used the term transvestite, which is no longer a term that we use in the DSM-5, because the language has had to be more gender affirming to people who, are experiencing this. So I'm guessing you've heard of the term transitioning. Transitioning also means a lot of different things for different people, but this is really when you're starting to make changes so that you're living within your gender identity. So for a non-binary person, they might seek out gender-affirming care, which are services that are designed to support them and affirm their gender identity. This could be mental health therapy. This could be somebody coming to therapy to talk with someone like myself or another professional about what they're going through. This could also be through different types of psychiatric services. You see hormone therapies, because some, even teenagers will start to have puberty blockers in order to prevent puberty from setting in as far as related to their sex assigned at birth. There's reconstructive surgeries. And we also have to keep in mind that transition can mean more of a social transition. And this is something I more commonly see with a lot of my clients, is that they really begin to make some of these social changes before some of these other types of interventions that would be more permanent would take place. And so that might be changing their name, changing their pronoun, their clothing, their hairstyle. I had a trans boy in my office the other day that his parents were on board with him cutting his hair. He was assigned female at birth and cutting his hair, and it made a world of difference. So happy to go to school for the first time with shorter hair. And that was enough to give him, a feeling of satisfaction, feeling like he was expressing himself more how he wanted to. So understanding this as far as just statistics and population, so 1.6% of adults in the US are transgender or non-binary. If we were to take that down into the under 30 crowd, it is 5.1% of adults are transgender non-binary. So this is one in, as far as young adults, one young adult in 20 are non-binary transgender. And so we are talking about 1.2 million people in the United States. And to me, that's quite a few people, right? So that's why we're having these conversations. So worldwide, I was looking at the stats on that. The percentages are pretty similar to the United States in that 1 to 3%, but some other countries, as far as where they're at with talking about these things, a little bit further ahead, in my opinion, than America, meaning that these things have already, there's been conversations about this, and this has been more normalized. And then we also have countries where that is not the case, right? So some of the risk factors, just as with all other types of minority groups in our country, there are risk factors. There's definitely substantial disparities in healthcare compared to cisgender people. And one thing I find for a lot of non-binary people is to even connect with professionals that they know are going to accept them, respect them, and understand them is one of the biggest difficulties, at least that I hear about, right? Because how do you know? How do you know when you walk into the gynecologist that this is going to be one who understands you and is going to take certain considerations in mind in treating you, right? Obviously, also targets of violence and bullying. Something that I often see, and it's surprising again as a cisgender person to me, is that teenagers will tell me, or kids, that other people at school are trying to figure them out constantly, that they're really subject to a lot of evaluation from their peers. the trans boy I was just referring to told me that he was at school the other day, and to him this is just another normal day. He was explaining to me that he was in line for lunch and the kids behind him were trying to figure out if he was a boy or a girl. And they were just talking about his hair, about his body, all of these things right in earshot of him. And we're like, do we call him an it? Do we call him a this, right? And he said, that's nothing, Abby. That's nothing. So that's the type of things, right, that makes me to choke up a little bit. So obviously these things lend itself to an increase in substance abuse, sexual behaviors, higher rates of suicide, especially suicidal ideation. And I differentiate that because with any populations of people, it's interesting. There are some that, because of what they're experiencing, like the things that they have more ideations or ideas about suicide, but not completion of suicide. And this particular group is that, meaning that we see a lot more thinking around suicidal thinking in this population of people, which this study came from an NIH study with 9th and 11th graders that they surveyed as far as those stats. So, as I said, some of the risk factors for them is that external minority stress of discrimination, harassment, non-affirmation of their identity or rejection. Judith Baker, who we listened to earlier, said that this is their thought on it, is that people who refuse to let trans people define themselves, sometimes they feel that it's because their own self-definition is destabilized, which can be really frightening for them. So for some people, it is thought that this feels too threatening to who they are as a person, that if they were to accept trans people or non-binary people, that that's something that feels very frightening to them. I've even heard some people describe it as it feels chaotic. All of the changes feel chaotic and a little bit unsafe for them. So, right, because we have to look at the other side too, right? I'm talking here advocating for, right, non-binary, but we have to understand some of the concerns that come from people who this stuff really is very unsettling for them. So there's the internal minority stress, which just comes from a lot of times non-disclosure. Not all non-binary people feel comfortable to share this about themselves, or they are, not able to express their gender because of their families, the churches they belong to, whatever those different institutions are. And then they obviously are also at a higher risk for the psychiatric morbidity, which is just the other risk factors, because just the examples that I've given, PTSD is a very common diagnosis with this population of people because of what they've been subjected to. And then transition in healthcare is another one of, again, finding those medical interventions to help support them through this process. Puts them at an increased risk for suicidal thinking, especially if they're not finding the people that they can have to support them. And then the reasons for living. So when people are suicidal, a lot of times what we look for is what are the protective factors that is going to keep this person feeling like there's a reason to live. If you have somebody who's non-binary, who does not have a support system that accepts them for who they are, it can make it more difficult to rely on those type of protective factors, right? And then we just have the demographics that, we see this with a lot of different, like I said, minority groups, where if, you also have a sexuality that is outside of being straight, whether that's being lesbian, bi, gay, or you're in a different minority group culturally or racially, that this just tends to compound some of the risk factors for this group. So with all of that, how do we support people? And I think one of the biggest steps is having these conversations. Because like I said, it's taking what other people might think about all the time and putting it at the forefront of our minds. And, right, to feel, like I said, understood and know that people are out there mindfully trying to make changes is how we do that. So I took this from one of the Stonewall websites, And they talk about that introducing yourself with your own name and your own pronouns, which might feel very unfamiliar for some of us, but that is one way that we show other people that this is something that we accept, this is something we're comfortable with, and we have respect for you as a person, right?
Excuse me, Abby, could you just say, I'm Abby, she, her?
Yes.
What's the phrase?
Yes, no, yes. Yeah, because we no longer, I don't often hear anymore that we use the word my preferred pronouns, because in that already suggests as if there is some sort of a preference. And that's, we really view it as, these are my pronouns, right? Just as I am female or I am male, not saying I prefer to be, right? Because that's as if then we're questioning the person's identity, right? So yes, so something like that, that's a good question. So we would introduce yourself with your name and then say my pronouns are she, her.
Okay.
Or they, them, whatever you might want to use, right? So you can also do this, a lot of people, I'm seeing this especially from schools, teachers, professors are starting to sign their emails with their name and their pronouns. I know that some doctors are doing this, some mental health professionals, so that's another way that we can, right, kind of convey that. Also, when it comes to, right, addressing groups of people and how we address, like, right, we used to say ladies and gentlemen, now, right, trying to say everyone or folks, right, like another way to address, because we're saying ladies and gentlemen, we're making an assumption about the crowd of people that we're in, right? Using terms, this one I will admit has been really hard for me. Using terms when it comes to relationships like partners, children, siblings. I catch myself a lot of times saying sisters and brothers when I'm talking to kids about siblings in their family, and using more general terms like siblings or just parents or caregivers is really important too. Because I know on a lot of health screening forms, a lot of times it used to say mother, father to get demographic information, and now a lot of times now it will say caregiver or legal guardian or things like that. So that's another way that we can do that. Not everybody is comfortable with the titles Miss and Mr. So not assuming that somebody wants to be addressed that way is also important. And again, back to just that not everybody uses the he and the she pronouns. The most common one I hear about is obviously the they, them. There are so many different pronouns, and sometimes even the pronunciation of them can be tricky. But they, them is most of the non-binary people that I work with, that is usually the pronoun that they use, is the they, them, in combination with she and he. So obviously not making any assumptions about that and maybe deferring to using or defaulting with they is sometimes the better route to go, especially when you're just not sure and you don't want to misgender somebody. I don't know if you've heard that term, misgendering, which is that you're using the wrong pronouns for that particular person. It also talks about that if you guys are in certain settings like workplaces, colleges, making sure that, again, your forms and the way that you talk about people's pronouns are being inclusive, and then having people who are role models for this, right? Having people making sure that there's representation when it comes to LGBTQA+ now is what it is in your communities. So what I was thinking here, let's see, is I thought to hear some teenagers and some people talk about why pronouns matter, we should hear from them themselves. So here's a quick clip.
Present more femme doesn't mean that I'm any less they, them.
You know what, that thing where you're eating a meal, but you're not really eating a meal, you're just kind of picking your food on the counter. My family and I were doing that one night, and I just kind of looked at them and said, hey guys, I'm non-binary. I don't have a gender.
In my opinion, gender is a universe. It is a broad spectrum of planets and stars and sky that truly cannot be contained into a binary.
My pronouns are they, them, theirs, and that's a non-negotiable. And they were all kind of like, okay.
I think one of the main reasons pronouns are so important is because other than our name, it's one of the main ways that people identify and call us.
My pronouns are personally very important to me. Growing up, enculturated into kind of a system that really subscribes to toxic masculinity. I was always uncomfortable with being called dude, what's up, man. I was so bad at dapping people up, how guys do that whole like that thing. I was so bad at that, and it just I felt very alienated every time someone would do that to me.
So when someone identifies with a pronoun, they're essentially taking their little piece of that broad universe and identifying with that. And so in using their correct pronouns, we're validating that yes, you are right in your identity and you are important and we're respecting you.
Coming into terms with my gender queer identity has been one of the most challenging but also rewarding things that I've done.
Laverne Cox kind of famously said, misgendering a trans person is an act of violence. And it is. It's an act of psychological violence. It's a denial of somebody's personhood and a complete refusal to acknowledge their identity, whether intentional or not.
And so it is something that is entirely wrapped around our everyday lives. So just walking into a restaurant and hearing someone say she, will happen within 2 seconds of me entering, which doesn't happen about any of my other identities. They're not gonna be oh, you straight person, that doesn't happen. But automatically someone will make assumptions about gender which translate into pronouns, which mean that I will hear over and over again people saying something about my identity which is false.
I think a lot of people associate expression with identity, and sometimes that's not the case. Oftentimes I'm in situations where I'm not the most safe being able to express my gender identity, and in those cases, even in those instances where I'm wearing basketball shorts or sneakers, you can't take my gender identity away from me because that's mine and not yours.
So many different options for who you are and how to define that. So when someone chooses a personal pronoun that they identify with, using that pronoun is a form of respect and a form of validation that yes, this is your rightful identity and I will respect that.
And I know personally when I get misgendered, by strangers it's one thing, but it's especially painful when it's people who are close to you. So when my parents misgender me, it's a knife in my heart because they're the people whose opinions matter more to me than anybody else's.
And not knowing how to combat it. It is constant and it is such a prevalent part of our society that being misgendered happens countless times in a day, and that builds up really quickly, and it can really be difficult for a person to hear over and over again because it invalidates your identity over and over and over again.
Pronouns are important because they are the smallest and easiest way that you can acknowledge somebody's identity.
And I also don't like that people call them their preferred pronouns because it's also not a preference. It's who they are. You need to use those pronouns. It's literally an extension of my arm or my leg. It's just as a part of me as a vital organ. My identity, although you can't see it, still needs to be validated just as much as you would validate the fact that I have 5 fingers or 5 toes.
I thought they did a better job than I. Talking about all that, right, as their own personal experience. Let me get back to my slides. So one thing that I'm happy to be able to share is that Nationwide Children's Hospital does have a program called the Thrive program. I don't know if any of you are familiar with it, but this is for caring for differences of sexual development and gender development. So I know a lot of times, especially as non-binary people, if they are wanting to do more changes with especially medical intervention, this is a program that we often refer them to because you have a whole team of professionals, as you can see. You have social workers as part of this, psychologists, you have urology, endocrinology, gynecology, the genetic department, right? So all of these people at Children's coming together to have this team that can help whatever different area you need that support with. And then I also put up here about the Trevor Project, which they are an organization that really helps with crisis and suicide prevention among LGBTQ youth in general. And they have a hotline in which you can call at any time of day. And then here in Columbus, another organization is Stonewall, which a lot of you might be familiar with, which really does a lot to do a lot of social and peer support for trans youth. So I did put some of these pronouns up here. Again, the pronunciation of them can be really, really tricky. And I do find that some people do use some of these other ones like the Z, the zer, the zers. But mostly, like I said, the they, them, their is what I see most often. So, when you ask people, I always, or if they're telling you and you're having trouble with the pronunciation, asking them to clarify that I think is important to do, but not doing it in a way that, we're kind of belaboring the issue and talking about it a lot, because we are going to have times that we mess up, and we were talking before this started about the fact that a simple apology, if you do make a mistake with somebody's pronouns, and then moving on, right? Because it really puts a lot of attention on any individual if we stop and talk about that mistake over and over again. So being just kind of mindful that kind of go with the flow is pretty important. So I'm hoping that from just the information about the statistics, about what some of the risk concerns are, what these terms mean, has just expanded maybe some of your own knowledge of this topic, because I think we're going to be hearing of this more and more, right? And so I think becoming familiar with it is important, because most non-binary people tell me, it's okay if everybody doesn't understand the ins and outs of all these terms or of me, but just show me a little respect, right? Show me respect in honoring that even if we don't understand, we can still honor who they are as a person by treating them in ways that are considerate and respectful, just as we would want as humans, right, with anybody else. So, I wanted to open it up to questions at this point, or maybe even comments or feedback about some of your own experiences. Yes, Dexter.
I had two questions and I got a roll, but
Yes.
First is, you addressed some of the risk factors that
Yes.
people have. Do we have data on when, let's say, LGBT youth is a part of a faith community that does affirm them? Do those risks, is that a positive health outcome? That's my first question.
Yeah, okay.
And the second is gender affirming care for minors, particularly as it relates to things like puberty blockers or whatever. I can imagine lots of folks who, look, I can call someone by their preferred pronouns, they want to present, that's fine. But when it comes to medical intervention for a minor, shouldn't we wait until they're 18 for them to make their own decisions? I think that's a pretty convincing argument for a lot of folks,
Sure.
but I also know there's reasons why we should be providing medical care to youth. So those are my two questions.
Okay, wonderful questions. So the first, as far as I don't have specific stats on the whole faith component, right? But what I do know that we have stats on is that if you are in communities of people where you feel a sense of belonging and are accepted for who you are, that is again helping in the protective factor for that particular person. And when I hear concerns of suicide for anybody, no matter who the person is, my thought is, how can we come from a place of love and support? Because our effort is not really our opinion on things, it's how are we going to help this person? Because if somebody is at that point in their life, this is, right, I feel like it's our obligation as other human beings to want to help them and support them. So, but I do hear, when I said I was doing this presentation to a couple of my clients, one of the parents even said, they're like, a church is having you come and speak? He said, the grandpa said, this is really encouraging. And I said, I can assure you, because I'm from a Lutheran congregation myself, and we are also, very affirming to all people and welcoming of all people. And I said, I can assure you that Covenant, among other congregations, really, supports people of the gender diverse communities. And very valid question about the medical interventions. And for me, I try not to have personally or professionally opinions on that, but you raise a very good question that I know a lot of people have about medical intervention. And what I do know is through the Thrive program, at least here in Columbus, having the supports and having kind of the legal consent of parents and family members to go through with some of these medical interventions. This is not something that's taken lightly, and that a lot of the risk factors are presented to them, is my understanding from the medical staff, if they are so choosing to go through that. But it is a very valid question that I know a lot of people are asking, and there's a lot of opinions on. So I don't know if I answered your questions there.
Yeah.
Okay.
One thing I've heard is particularly, let's say you're born a male, but you decide as an adult you're gonna transition to female.
Mhm.
And if you've gone through the puberty process and you've got a square jaw and a male body, do you know how much more violence you welcome?
Yeah.
Because you've gone through that puberty process.
Mhm.
That trans women are some of the most
Sure.
murdered people
Mhm. Yeah.
across the world.
Yes.
And if you can intervene sooner, you can actually
Yes.
prevent the violence, and that it's not done haphazardly.
Yeah.
If you are getting puberty blockers, there is a huge amount of medical community that is surrounding this person. It's not just doctors going, hey, you want to be whatever you want, great.
Yes.
Let's just cut you open. That's not
No,
how this
absolutely.
works.
And a psychological component.
Yes.
So I myself do not do the forms for approving, if that makes sense, the psychological evaluation for someone, because there are certain things that they are looking for to make sure that some of these things going on isn't maybe a trauma response, or that there's not other factors. And so there are people that are well trained here in Columbus that I refer to who help with the psychological process, especially if they're over 18, because the Thrive program is more for kids and teenagers. Yes?
So, as a retired family doctor, this is a hot topic.
Yeah.
In terms of puberty blockers. I'm still board certified, and our board certification now is done online and done in chunks over years.
Yeah.
And one of the recent questions was, parents bring a 13-year-old to your office. And I mean, there's a right and wrong answer according to the board for this, you know. And they're convinced that this person needs puberty blockers and this child needs puberty blockers, and they're willing to sign the consent forms, and should you do it or not? You know, and there were 4 different choices. And the right answer was you should give it. But we get a comment section too, and I can tell you that, you know, from the board certified family doctors, I mean, there was a spectrum of answers in terms of no, never, and yes, I mean, you have to treat them like any other human being in terms of treatment. So, I mean, it's an area that's very much in flux.
Absolutely.
And especially for practitioners that are out in the hinterland. I mean, what Children's Hospital has is the ideal, because since we don't have the data, you know, you take 10,000 people in that situation, then 13 think they want to transition, and as you know, gender is fluid. You know? So
Yes.
do you block them or do you not? Do you submit them to violence, maybe, or not? And you know, if we had 10,000 people and put them in randomized studies and watched them over time and transition, let some transition afterwards or before puberty, we'd know better answers. But right now, we don't have those kind of science. We don't have that data. We don't have that.
A lot more research is needed.
So
Hard to do it because you're taking someone's life and
so we don't know. We really don't know. So you have to, the parents, really it comes down to the parents,
Yes.
have to make the best decision possible for their child.
Yeah.
And a support system like Nationwide has is ideal, but not everybody.
Not everybody can access that.
No.
Or even spend like they can't, really don't have
Yes.
gas money to drive.
Yes.
My understanding with the children's program is from an article in a newspaper, I think was that through like suicide, you know, ideation or actually trying, you know, that they can, this is a place that will treat children who are committing suicide, who are having all of these thoughts. And then I'm assuming that's an access point for this whole team. I mean, but it might be, if it were someone who is having the kind of issues we're discussing, it would be access to that team. But you're right, children serves, it would need a referral from the GP.
You need access to the system.
Right,
You're out of the system, you can't even get there.
Yeah. Which is why we're talking about one of the risk factors is just accessibility to gender affirming care. and having a support system within your family that is going to seek out that referral, because I know many families who do not then choose, even though that referral is made, do not choose to act upon it, maybe because of some of their own reservations or concerns or just differing opinions about it. So I appreciate you offering your perspective as somebody in the medical community, because everything you're saying is very true as far as just that we need more research about this, and that it puts professionals working with these populations in sometimes a very difficult position, right, in making decisions related to the healthcare of non-binary people. Children, yeah.
It's a little bit easier with adults.
Yeah.
They make their own decisions.
Yes, absolutely. But I appreciate you all being so, listening and patient with me. I don't know, does your service start at 10?
We do start.
Okay, I was thinking you're probably gonna be moving on to
Yeah.
your worship.
Right, yeah, so what we can do is if you feel like you need to get up and go to church, that's great, you should definitely do that. And if you have a few more questions, I suspect that Abby might be able to stay for a few
Absolutely.
minutes to answer those. I will point out, I'm gonna be sort of like providing and maybe even almost littering the church these pronoun stickers. They're about the size of a nickel, and you're invited to place those on your church name tag if you would like to. Last week when we had our speakers, 2 weeks ago when we had our speakers from Sanctuary Night, we had Hannah Estabrook, and then we also had Nancy Hashman. Nancy Hashman is a survivor of human trafficking. She spoke a little bit about her daughter at the end of the presentation. I greeted them and thanked them, and Hannah said, "Oh, I forgot to tell you, this is a welcoming church. Your name tag sticker reminded me that this is a welcoming church. Hannah, you can talk about your gay daughter all you want here, and that will be fine with the people." So if you feel a little awkward about saying, "Hey, this is my name and these are my pronouns," that's one way that you can just do it non-verbally, share those non-verbally, if that's more comfortable for you. I just think we need to do all we can for our kids and anyone who's feeling kind of fragile because they're going through a time of discernment about who they are. We talk a lot about love around here, and it's a great way to love people. I also think the words respect and love, it's really kind of hard to tell the difference if you're doing them both really well. And so to be respectful is to be loving in so many cases, and it's a super easy way to do it. You'll see them all over the place. I hope you'll pick one up.
Thank you.
Okay, so if you gotta go to church, you gotta go to church. If you have questions,
You're welcome.
Thank you so much.